Mr. Secretary, thank you for the time. I want to ask you about this money that is going to schools across the country, but Texas in particular here, $12.4 billion going to Texas schools K through 12. The big question that a lot of people have when they see an influx of money like this is, how do you make sure that this money is going to the classrooms and the students who need it, the students at risk, disabled students, homeless students, et cetera? How can you make sure that they actually benefit from it?
Well, first of all, thank you for having me. Glad to be here with you. And you're absolutely right. This is an influx of money. This is unprecedented. And it's critically important that we make sure we're transparent with where the money is and how we're spending it. Part of the plan for us was to ensure that states were communicating with us what they were thinking. And two things that were not negotiable are, number one, ensuring that there's an equity lens. We know the pandemic hurt us all, but there were some people that were impacted much more than others. So we want to make sure that these funds are used to equalize the playing field, if you will, and provide those support for those students that were hit the hardest. So that's number one. Number two is stakeholder engagement. We expect all communities to bring in to the conversation the perspectives of the various stakeholders, including families and students, to make sure that the money is going toward not only the students that got hit the hardest, but in ways that they need help.
Mr. Secretary, as a parent of two elementary age kids, what should I expect for my child's classroom with this money?
I'm a parent too, right? So at the end of the day, you want to make sure that your children are going to school in an environment that's safe. That's first and foremost. And you want to make sure they're going into an environment that's providing them with the tools that they need to be successful. So what reopening should look like with the support of these funds includes a better social emotional program where students can re-engage with one another. Students have been sitting behind a computer for a good part of a year. So we want to make sure that the social emotional support is there. We want to make sure that mental health support is there, and that we're receiving our students in an environment that supports the fact that they've been through trauma together. Now, some families experience loss of family members. Others, they might have experienced loss of jobs for people in their homes. And others just being disconnected from people for over a year in some cases. We want to make sure that our schools are welcoming environments, but then that the academic support is there. Students missed out on learning time. So we want to make sure we're doubling down on those experiences to give those students an opportunity to catch up.
Colleges are also getting a big chunk of this change. One of our congressional representatives from Texas mentioned that just in the Dallas area alone, there was, I want to say it's $100 and something million going to HBCUs here. But I understood also there was another allocation of money going to HBCUs. Are they double dipping?
It's a total of about 2.6 total. And the goal here is to make sure that, like I said earlier, there's some places that don't have huge endowments. And in order to keep them supporting students, 50% of the funds that go, and I think $3 billion is going to Texas, about $3 billion is going to Texas in total. About half of that has to go to student aid. Again, we're wanting to make sure that we're supporting those students that have been hit the hardest. And we know that HBCUs provide a service for students. So we want to make sure that they're getting funds to allow them to do their critically important work of getting our students of color graduating and successful in life.
I want to ask you about something else. I'm sure you haven't seen this study, but the University of Kentucky released a study just recently suggesting Texas might have reopened its schools too early. And the findings there from UK say that 42,000 additional COVID cases likely developed because of this, 800 deaths or so. But now with schools reopened and people making plans for the fall, should school districts allow kids to return in the fall without masks, without protocols, in your opinion?
I'm going to lean on the updated CDC guidance. And right now, it says we should be having our students wearing protective gear and our staff. And I think what we found too, I was a commissioner of education in Connecticut. We had school districts open. My children were fortunate to be in school since day one with masks, with those mitigation strategies that were recommended by the CDC. And thankfully, we didn't have spread in schools. And in fact, the transmission rate of COVID in schools was less than the community, because we knew that students, when they were in school, they were following those mitigation strategies. And it's critically important that the adults follow the science to make sure that we're listening to what the CDC experts are saying. This is a health pandemic. So yes, it's important to reopen schools, but it's critically important to do so in a way that's conducive to ending this health pandemic.
And then last thing, I'll let you run here in the last 60 seconds. One thing we noticed in Texas, I don't know if you're seeing it nationally, no one is keeping track of the number of students or teachers, faculty, anybody inside the education system that are getting sick from COVID or dying from COVID. Is that a number that we should be recording?
You know, the data tracking systems that we're developing are intended to make sure that we're identifying what the needs are. But keep in mind, if you're talking about K-12 schools and higher education institutions, I think it's critically important, because when I was commissioner, we were looking at these data as well. You know, you can't say because they have COVID in our schools doesn't mean that they got it in our schools. So tracking where they got it, contact tracing is critically important. And a lot of the districts that are doing it right are communicating with their health departments to make sure that the contact tracing is preventing the spread. So I think the health departments that are contact tracing well have the information on where the person contracted it, and that information is kept locally as well.
Mr. Secretary, we appreciate the time.
Pleasure to be with you.
6:01, Vanessa, don't forget.